Tooth banding is a slang term used by those in the orthodontic field to refer to the placing of metal bands on the teeth, usually on the molars. Here you see a plaster model with such bands. The actual bracket is welded to the bands. At a later point in time, a wire will be incorporated into the brackets. These bands have a much greater tensile strength and can tolerate far greater forces than classic brackets, which is the only reason doctors sometimes use bands instead of classic brackets. Why are greater forces an issue? In the image, you see a headgear device. The force of the springs built into the mask would be too great for the brackets. Thus, the force is simply transferred to the bands. In most cases, so-called separators are placed between teeth a week prior to banding. That way, the bands can be painlessly placed on the teeth. In the first step, the appropriate band is selected for the matching tooth by a process of trial and error. This is important so that no unnecessary gaps develop between the teeth. The appropriate metal band is filled with cement and lightly pressed onto the tooth. With special instruments and great care, the band is eventually moved to its final position, where it will stay throughout the entire treatment period. The risks related to tooth banding are usually relatively small. However, complications can develop in individual cases, and these may require additional measures. Each additional measure can in turn lead to further complications, which may even result in the loss of a tooth during the course of treatment. At this point in our discussion, we will only deal with the specific complications associated with tooth banding. These include, for example, caries, which can result from a poorly cemented band, damage to neighboring teeth, or periodontal damage due to improper cementing.
In orthodontics, a bracket is the term used for the restraining element on permanent braces. Brackets are glued to the tooth surface by special gluing techniques, thus creating the starting point for tooth realignment with attached permanent braces. In this film, you can see the gluing procedure, which is pain-free. A metal arch is then inserted into the bracket. This metal bracket applies the force necessary to initiate tooth movement. There are different bracket variations. These are characterized by materials, metal, gold, plastic, ceramic brackets, or method of attachment, Damon lingual brackets. Lingual brackets are attached to the back of the tooth. These brackets work well for patients who place a high value on aesthetics. Inappropriate gluing techniques or insufficient dental hygiene while the bracket is glued to the tooth can lead to permanent decalcification spots on the tooth surface. For this reason, good dental hygiene is very important. The use of a dental water jet toothbrush is highly recommended.
The separation rubber band is a tool that helps with the dissolution of teeth contact areas. Our teeth border each other at the contact areas. If a dentist wants to work within these areas, tooth contact needs to be dissolved. This is also referred to as separating. There will be more about that in the video by the same name. Separation rubber bands come in various versions and strengths. It's important to only place parts of the rubber band over the contact point. The rubber band should also not be overstretched, otherwise it could lose partial functionality. After about 2 or 3 days, the rubber band has done its work, and the patient should pay another visit to the dentist.